students, if not for you, healthcare in the United States is now the 6th largest economic undertaking on the face of the globe. We're slightly smaller than the Chinese economy. We're much larger than the Italian part of the economy of the United Kingdom. It's a big honey pot, and no wonder it took forever to get anything changed in Washington. $2.5 trillion, if you just do the math, that's about what we spend. No one really knows. We'll talk about that in a second. What $2.5 trillion is, we got some help on that. 16%? That's the percent of the uninsured. So we have the most expensive healthcare system in the world, 6th largest economic undertaking, and about 45 million folks, up until 2 weeks ago, didn't have ready access to insurance. Now, we all know they got care, but it was not the best care, and it was kind of expensive. But 125, 10,000. We start with 100,000. That's what the Tayar's Human report from the Institute of Medicine said, the number of avoidable deaths in the system. And the guy who wrote that report, Bill Richardson, is actually a pretty good friend of mine. And he's a great public health researcher. He'd be the first to say 100,000 avoidable deaths in a year. Data was a little skunky, the analysis questionable. But let's just say that he's right, and it's only 10,000. 10,000 avoidable deaths in the U.S. healthcare system. Now, 4 or 5 years ago, there were 4 pediatric deaths up in the Northwest Seattle area, I think, or Portland, E. coli deaths from fast food. I think Jack in the Box, but I can't remember. Now, and we shut down the company until we found the agent for 4 pediatric, and we should have. Now, I understand, you go to the hospital, you have some expectation you're going to die. You go to the Jack in the Box, you don't have that expectation. We might actually want to reverse those. We probably do a lot for population health. But 10,000 avoidable deaths for the most expensive healthcare system in the world. I want to ask about the next slide, the 4th. It's related to this one. In the past 24 months, there have been 3 separate independent published studies in New England Journal, JAMA, and MMR that concluded that the 4th leading cause of death in the United States is checking into the hospital. Not because you checked in with a cardiac event and died from it. That doesn't count. You know how we count these things. You checked in, and our wonderful healthcare system, and many parts of it are absolutely exquisite. They saved you from that cardiac event, but you died from contracting hospital-acquired infection or medication error that occurred because there was a miscommunication along the physician, pharmacy, nursing pathway. 4th leading cause of death. In 2011, it's next year, I know that. That's how much time they've given me from this talk. Well, the first 5 dots, bullet points, are a picture of a big fan. I live in the East Bay, in the Bay Area. I fly out of Oakland. When it gets hot, we get these enormous floor fans. Must be 8 feet tall. You've ever seen those things? Big. So those first 5 dots are those big fans. 2011 is a big sack of stuff about to hit those fans. 2011 is the year that the first baby boomer hit 65. Right now, before I'm through speaking, about 450 people will turn 65. Today, no more than that, yeah, roughly that. About 7,000 a day turning 65. And as they do, they get free health care. Until when? I didn't want to have that data there. When is the projected bankruptcy for Medicare Trust? 2014. Yeah. I'm more confident about the bankruptcy of Medicare than the projections from Revelations, but that's just me. So this is why we can't keep doing it the way we're doing it. But the most important thing back in September when the president gave that talk about healthcare, the most important sentence had nothing to do with healthcare. He said, there's no balanced budget without healthcare change, without fundamental reform. We can't continue to pull down resources at this rate. So that's why we got to change. But in changing, there's an enormous amount of opportunity for everybody, but not in the old paradigm. The opportunities in the new paradigm. looks complicated, and it is. We give you the thing you generously didn't say about me was that I have absolutely no reason to be standing up in front of these people, even with my joke about the Irish twins notwithstanding. My PhD is actually in history, so now you can really discount anything I say. I show with some trepidation a slide that says mid-1960s, but just a quick sketch of why we're in this suit today. And I don't think your students or you can actually help unless you at least have some appreciation for this transition. Here's the public up here. And we'll say this is 1963. The public has unlimited choice. It's a totally uninformed choice, but unlimited. Healthcare doesn't really cost much. In 1960, healthcare was about 5.5% of GDP. Most people could pay for it out of pocket. My mother, who was the wife of a good health insurance executive, who whenever I use this slide, I can hear him whirring in a grave place. She would never take us to the pediatrician for immunizations because the shots were free in the public health department. All right? And you were watching your pennies. They were all Depression-era people. We called insurance back in the 1960s major medical because it actually insured us against financial catastrophe. It didn't pay our medical bills. Our medical bills were our responsibility, and it was a generation that still had a lot of capacity for showing that. Well, they made unlimited choices, and they went to go by asking their neighbor, who do you see? I see Dr. Jones. Is he nice? Yes, Dr. Jones is very nice. I think I'll go see him. That was the nature of consumer information and decision making. And Dr. Jones might have been nice, might not have been nice, but we don't know anything about Dr. Jones' clinical ability. Now, there wasn't a lot for Dr. Jones to do. This is the international symbol for a medical practitioner. Aging, balding. If it was full figure, it'd be paunchy as well. Don't laugh so hard. I got some nurses coming. But once in the system, the incumbents, the docs, the nurses, the dentists, the hospitals make all of the rules for the system. Sometimes they did great things. Sometimes they did indifferent things. Sometimes they did things that were actually harmful, but they thought they were good. And they did them systematically. These guys did these things and without any restraint passed bills over here. And here's an example of things that might have been harmful. About 68% of the baby boom generations don't have their tonsils or adenoids. Today, what's the indication for tonsillectomy? Almost nothing. Some congenital abnormality, physical blockage, severe recurrent infection, which nothing else works. Maybe we'll try that, and it's almost never